Okay, good morning. The dilemma that we posed yesterday is a 71-year-old patient with an underlying heart condition arrives at the hospital with symptoms of COVID-19. He's placed in isolation in the emergency department. Test results confirm the patient has COVID-19. His condition deteriorates and is placed on a ventilator. During his stay in the hospital, infection rates spike in the city. Severely sick patients overrun the hospital capacity quickly, and there aren't enough resources. Many of the patients are young, between 20 and 50, and otherwise healthy, but still require ventilators. Doctors, nurses, and the rest of the healthcare teams are forced to decide which patients they should focus their attention and care on. Would you prioritize the care of the healthy and younger patients and shift the ventilator from the elderly man to patients with a high probability of recovery? So we did the survey, and 59.46% of people said no, they would not remove the elderly man, and the balance, which would be 40.54%, said yes, they would. So where's the halacha sit on this? So the Gemara comes and tells us that it's a statement that a local man came over to Rava and said to him, the governor of the town has told me to kill somebody else, if not he will kill me. What should I do? To which Rava responds to him and says, you should allow yourself to be killed rather than kill him. Who's to say that your blood is redder than his blood? Perhaps his blood is redder than yours. And it is this concept of machazit, is what do you say to demais samik tfei, that your blood is redder, is this idea that to be able to qualitatively determine whose life is more important is something that we as Jews do not have the ability to do. So therefore, to come to a situation where one has to pick between killing somebody in order to save somebody else's life, one is not allowed to do that. So when it comes to taking somebody off their respirator in general, the rule is that if the person cannot survive without the respirator, and by taking them off the respirator they will die, then halachically one is not allowed to remove them from the respirator. If they are on the respirator but they are halachically dead, which is usually mean there's no brain function whatsoever, so then even though they are technically, the heart is beating and they are breathing, that since there's no brain function whatsoever, so the person is dead, and therefore would be no problem to remove them from the respirator. But here we have a case where the elderly man may or may not survive, and the younger man, one would expect the world. So to remove the elderly man would mean that seemingly in this scenario, seemingly certain death, that they would not be able to breathe without it, and therefore it would be prohibited to take the person off the ventilator. There are some people brought some situations of possibly putting people on ventilators, on time switches and the like. That is generally not the rule. The rule is that we don't speak. There's another question which comes is not putting somebody on a ventilator to begin with, which is a much easier question to deal with. But to withdraw treatment from someone that will cause their death, this is something we don't do. And so no, one may not take the elderly man off the respirator.